Right, I think we'll get kick-started. I'm sure there will be other people that will be joining us. But if we just start off with some housekeeping and some introductions. So I am Liz Cullen. I'm Head of Clinical Delivery for Perinatal Mental Health and the Staff Mental Health and Wellbeing Hubs, working in the South East Regional Mental Health Team. And we just wanted to welcome everybody today to our session focusing on perinatal mental health and particularly thinking about the 5 to Thrive model and the training that we will be rolling out across the region for the perinatal mental health pathway and beyond. So a couple of housekeeping rules. So just a reminder to please keep your lines on mute and video cameras off unless you are presenting or you're asking a question. It just helps with kind of background noise, etc. Please do raise your hands, obviously, to ask any questions, make any comments, and also use the chat function. Feel free to introduce yourselves within the chat function so that we know who's in the virtual room. And just to let you know that we are recording the webinar so it can be shared on the website for those that aren't able to attend today. Anisha, would you like to also just introduce yourself for a second?
Yeah, absolutely. Thanks, Liz. My name is Anisha Gardia. I'm a trainer with Knowledge Change Action, or KCA. And yeah, just delighted to be with you all today and excited to tell you about the learning journey that we've embarked on with NHS England South East. So thank you for having me.
Thank you, Anisha. And also apologies from Jenny Walsh, who is our clinical lead within the South East for perinatal mental health, who was due to be here today, but is sadly off with COVID. So apologies from her, and we wish her a speedy recovery. So I just thought I would kick off before we go into the main session, which will be focusing on 5 to Thrive, just reminding us, what is the ask of the long-term plan in terms of perinatal mental health, and just to remind ourselves of the context. So obviously, in terms of perinatal mental health, it's very much focused on the expansion of the specialist services and increasing the number of women seen to 66,000 within 23-24. So the access target this year has just raised to 10% for women to be seen by specialist perinatal mental health services. And also included in with these ambitions is obviously very much about extending and expanding the services. So historically, perinatal mental health services were 0 to 12 months. And this is obviously expanding to 24 months, so to that toddler age, which therefore fits in really nicely with the 5 to Thrive model and that kind of interface between perinatal mental health services and children and young people's mental health services. Also expanding access to the evidence-based psychological therapies within perinatal mental health, including parent-infant, couple, co-parenting and family interventions. And then also the aspect of partner assessments, so ensuring that the partners of women accessing specialist services are also assessed and received evidence-based assessment of their mental health and are signposted appropriately onto whatever support is required for them individually. Obviously, in the last couple of years and within the South East region, we are developing the maternal mental health services. Within the South East patch, we had 2 early implementers in Kent and also Hampshire and Isle of Wight. And then our fast followers have been Frimley, Bob and Surrey, and Sussex is also coming on board. So this is about integrating maternity, reproductive health and psychological therapy for women, thinking about birth trauma, birth loss and tocophobia. And obviously it's both a long-term plan ambition for both mental health services and maternity services. And then there is also work to fully deliver the 5-year forward view commitment, and that includes increasing capacity for mother and baby units by 49% for our own region within the South East, where we have established mother and baby units within Kent and Hampshire. We have extended our beds to date, but many other parts of the country will be expanding bed facilities further. And then also making sure that we have that seamless transfer of care between perinatal mental health services, both physical health services into maternity, but also into other mental health services, particularly thinking, as we say, about children and young people mental health services moving forward. And just a little bit more in terms of the access target. So 10% is ambitious, and within the South East, we are not at that 10% point yet. But obviously last year the target was 8.6%, and really in order to hit the access target, it is about expanding the cohort of women that are seen in line with the long-term plan flexible ambitions. So thinking about that wider cohort within the 0 to 24, so that 12 to 24 month period, also increasing the level of access with the psychological therapies as we introduce the maternal mental health services. Obviously those access will also be included in the access rates. And although the partners assessment does not directly increase the number of women supported, it is essential in terms of thinking about that family approach and that holistic service that we offer as mental health services. As well as the long-term plan ambitions, there is also the work going on in terms of provider collaboratives, and perinatal mental health is kind of almost like the last in line of the other mental health services to move forward with the provider collaboratives. So the work has started. There's been a national programme since November 2019, specifically for perinatal mental health with this, in line with the commitment that by 2023-24, all appropriate specialised mental health services will be delivered through a provider collaborative model. And a task and finish group was established in November 2020 to lead this and take this forward. More recently, the programme at a national level was paused with the Omicron wave of COVID. However, this is now reconvened in the last month, and the national proposal is that the go live dates for the perinatal mental health provider collaboratives are January 2023, and all by the 1st of April 2023. So this was agreed at the national February meeting, and there is implementation guidance being worked up at the moment, which is due to be published in the beginning of May, so in the next couple of weeks. From a regional perspective, we have been working obviously closely the regional mental health team and specialised commissioning colleagues, and we had a stakeholder engagement event back in November. There is a recording of that event and webinar if people were not present at that meeting and want to have a refresh of that. Following that meeting, an options paper was developed, which was shared in January. And although then the national work and consequently the regional work was paused, we're just about to reconvene that work by sort of doing a refresh of that options paper, revisiting it locally as a region, and thinking about kind of the discussions in terms of lead providers and the geographies for the provider collaboratives for our region. So there will be further work being done over the next couple of months with that. And I just wanted to highlight, and hopefully you will have already received communication about this, but there is currently a national benchmarking survey going on in terms of 0 to 5 mental health services across England, which is so key for this perinatal mental health pathway going into children and young people's mental health. The deadline for that is Friday the 10th of June, and that's very much focusing on the current service provision available. And then from the kind of data collection exercise, there will be a report that will be issued for each of the 0 to 5 mental health services based on the data collected. So there will be further information that we will share in time, but just encouragement, please, to if you haven't received details about that survey, please do let us know, put something in the chat, and we'll make sure that that gets forwarded on to you. So that you can cascade to your services. Thank you. And then I just wanted to highlight, which takes us then nicely onto 5 to Thrive work that we're doing, but with regards to the commissioning of education and training specifically for the perinatal mental health pathway. So each year, NHS England as a regional team has been awarded money via Health Education England to upskill the workforce, and as the services expand for perinatal mental health. And within the South East, we have the Perinatal Mental Health Academy, which is a kind of online resource for all our training resources, useful links, the webinars that we do, etc. So please do have a look at what is available to all stakeholders within the region. And then this is just a kind of overview of the various different training and education programs we have put on very much across the full perinatal mental health pathway. So also upskilling of health visitors, maternity staff, social care staff, etc. Anybody kind of who interfaces with the perinatal mental health pathway, also kind of 111, paramedics, etc. And KCA is included in that. And in the last year, we have, I worked out on a crib sheet, I think we had provided 1,000 training places, and because many of the training places, training that we deliver is through a kind of train-the-trainer approach, that would also offer further training to another 1,500 professionals. So that takes us nicely on to 5 to Thrive, which is why we're here today, to kind of discuss kind of an introduction to 5 to Thrive and the proposal of how we are going to take the training forward across the perinatal mental health pathway within the South East. So I will hand over to Anisha and I'll stop sharing.
Thanks, Liz. I'm just going to share screen and get my presentation up. Bear with me. Oh, no, that didn't work. So I hope that everyone can see that okay now. Is that okay, Liz?
Sorry, I'm on mute. Yes, that's perfect.
Yeah, brilliant. Okay, so thank you again for inviting me today. So as I said, I'm Anisha. I'm a trainer with Knowledge Change Action, or KCA. I'll tell you a little bit about KCA before I get into the content of today. So KCA is a social enterprise that has been promoting trauma-informed practice for over about 10 years now. And our trainers come from multi-agency backgrounds, so including early years, schools, fostering, social work, criminal justice, mental health, and other therapeutic disciplines. And what we do is we use evidence from research on attachment, trauma, and resilience to improve everyday interactions, to help practitioners to improve those everyday interactions that they have with their clients, with their service users. And through overlaying the knowledge of neuroscience, we help people understand our shared vulnerability and also the importance of building relationships to create compassionate and resilient communities. So I want to introduce 5 to Thrive and talk a little bit about how it underpins attachment awareness, trauma-informed practice, and building individual and community resilience. I'm also going to share a 5 to Thrive case study with you, introduce the commissioned learning journey, and then describe some of KCA's learning resources to you. So KCA has a learning management system called KCA Connected, and all your learners will have access to that learning management system and a whole host of resources that are available on that system. So this programme of learning seeks to develop 5 to Thrive across the whole perinatal mental health pathway, working with under twos across NHS England South East. The full training programme will help practitioners who are delivering services and supporting families to work in a trauma-informed way and to understand how relationships promote healthy brain development. The content includes input on the impact of unregulated stress on brain development and function, and how to promote recovery from trauma by recognising the outcomes of recovery in order to build resilience. There'll be further opportunities, as Liz has already said, for practitioners to attend training to become local 5 to Thrive champions and local trainers to help maintain wellbeing in the workplace, as well as supporting application of knowledge to practice. You know, we're really keen that this learning is used in an ongoing way. And those trainers then are able to cascade the learning content to their individual teams and settings. And alongside this learning pathway, NHS Frimley CCG is running a parallel 5 to Thrive training programme with KCA. And that's targeted at teams working with children and young people and their families aged 2 and upwards. So if you have practitioners in your teams working with over 2s, then they'll be invited separately to attend the NHS Frimley CCG training programme, which launches next week on the 4th of May. So in terms of training or learning content, Liz and Jenny are keen to see some key outcomes around commonality of language between services and settings when considering attachment, trauma and resilience, making every contact count by optimising engagement with parents and caregivers. So this idea of every interaction being an intervention. There's also fostering positive relationships of support and taking a strength-based approach to minimising any instances of judgment or shaming. So at KCA, we very much advocate the use of compassionate curiosity to create distance between behaviour and judgment. And KCA's models of practice represent a bit of a paradigm shift from seeing dysfunction and deficit to acknowledging strengths and noticing points of connection, because when we notice responsiveness and connection in our own practice, we do it more. And the same goes for parents that we work with. And we want to ensure that the knowledge base in neuroscience research is accessible to all. So we use language and models that that everyone can understand. We also want to help practitioners recognise that trauma-informed practice is grounded in this understanding that resilience is a state, not a trait, and we can all be vulnerable and we can all be resilient depending on the stressors we're contending with and our resilience at the time that we encounter those stressors. And 5 to Thrive can be used as a model for meeting the need for safety and connection within the workforce and families when we're feeling vulnerable. And then finally, we've got increased workforce attraction and retention through the development of confidence, skills and knowledge. And there's a lot of synergy between the outcomes identified by Jenny and Liz and national priorities around the NHS long-term plan to extend specialist community services from preconception to 24 months. You know, we're responding to the impact of COVID-19, so that's another crucial priority. Pandemics are known to be traumatic events. They lead to high or even toxic levels of stress in the community. I don't need to tell any of you that. And it's just about acknowledging that impact on social networks. And Ofsted reported recently on the impact that this has had on the psychosocial and physical development of very young children. And of course, we know that those who have had a network of support around them have and will recover from the impact. However, the more vulnerable in the community will need ongoing support, particularly in terms of regulating high levels of stress. And this is also true for our workforce, who've experienced huge change in working practices in the last 2 years. And the CQC report in February this year reported high levels of exhaustion in the health and social care workforce. So some of the issues we touch on as we share this knowledge base with your practitioners includes thinking about their own resilience, thinking about secondary stress and trauma. And of course, we want to improve engagement. We want to ensure that children and parents have the support they need, and that our services, that as services, we're viewed and seen as caring and approachable rather than overwhelmed or lacking empathy. So the knowledge we share is based on attachment theory and the aligned neuroscience about the importance of connected relationships and responsive parenting for healthy brain development, and increased health and well-being. Now, your practitioners will be very attachment and brain aware, so we may not spend, too much time on this, but we will share some key messages around stress regulation, the impact of toxic stress, and recognizing the importance of those connected relationships, as well as noticing and actively promoting such relationships in their own practice to help children and parents develop resilience. And this discussion will be expanded to thinking about the importance of attachment relationships beyond that parent-child dynamic, to thinking about the importance of connected relationships across all ages and stages of development, even into adulthood, as well as in our settings and services. We all need people who help us feel safe, who will co-regulate with us and help us make sense of difficult experiences, that co-learning aspect of relationships. So that brings me nicely on to 5 to Thrive, and I'm just going to click through this slide here. So 5 to Thrive is KCA's model for promoting secure attachment relationships and for noticing what happens every time we connect to meet an attachment need. And as I said, it's based on a growing international evidence base from neuroscience. It embraces John Bowlby's theory of attachment. It's inclusive in its application across age phases, developmental stages, and abilities. And it's based on the premise that what happens to a baby or child shapes their brain. And the most important thing that happens to the baby or child, of course, is the parent or caregiver. So everything that parent or caregiver does when they are with the baby or child sparks those wonderful connections in their brain, turning those connections into pathways that pattern the brain, and to which, they can return or engage with again and again and again as they grow and develop. So just as a child's body grows better when they're given healthy, nutritious food, like the 5-a-day campaign that we all saw and knew many years ago, that encouraged the eating of 5 fruits and vegetables a day, so the child's brain develops more healthily when you do 5 simple things that feed the growing brain. And we've simply captured those 5 things in a model that we call 5 to Thrive. And it's a model, as I said, for meeting needs and building brains from little tiny baby brains right up to maintaining adult brains. So although the focus here is largely under 2s, it's a model that applies across the whole lifespan. So 5 to Thrive is a sequence. It's a neurophysiological sequence. It's not 5 activities that you do separately. So these are 5 neurological, very fast activities usually that happen in the blink of an eye in our brains when we meet a need in others. The activities happen in this sequence. So respond, engage, or cuddle, relax, play, talk. So it's respond, engage, relax, play, talk. And we sometimes substitute that block engage for cuddle. And I'll come back to that in just a moment. So every time we engage with another human being to meet a need, this is what happens in our brains. So when meeting the need of a child, the focus is on the brain of the parent or the caregiver, or as practitioners, the focus is on what's happening in their brain as they support parents, children, and colleagues by co-regulating. So if for a moment you think about me responding to a baby, so the baby's crying and needs connection. So I respond, I've noticed an attractive or aversive behavior. And when I notice this, my brain and nervous system switch on and they get ready to engage or connect to the baby. So this is the next block. It's cuddle for babies and engage for everyone else. It's the same thing, but we can't engage at a nervous system level with a baby without touch. So the element of touch is really important with babies because their brain circuitry isn't sophisticated enough yet to pick up on the nuances of social engagement. So to engage with the baby, I pick the baby up, I hold its little hand, I gently rub its tummy. And the minute I do this, their brain and nervous system starts to engage and communicate with mine. So my brain and nervous system switches on and engages with the baby's nervous system through touch. And because I am in that moment a responsive adult, I pick up this little baby and I'm saying shush, 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 and I'm rocking from one leg to the other. I'm patting the baby gently on the back. And this, in fact, does nothing for the baby. But what it's doing is it's soothing me. It's settling my nervous system. And when my nervous system relaxes, so that's the next block, relax, the baby's nervous system mirrors and matches my nervous system and relaxes too. So the patting and bouncing and the rocking isn't helping the baby, but it's helping me. And once I've done that and I've self-regulated and relaxed, the baby relaxes. So it's all happening in my nervous system first, and then the nervous system of the baby. And then we've got those last two blocks, which are play and talk. And these two activities are about engaging the parts of the brain that were disengaged because the baby or child was experiencing stress, be that the stress of a wet nappy or being hungry, or because a familiar face has moved out of view and an unfamiliar face has taken its place. And at this point, the play block isn't about getting toys out and playing, but it's about playfulness. It's about our non-verbal social interaction, activating the social emotional brain of the baby or child through facial expressions, gestures, soothing noises, a smile. And through this, what I'm communicating here is that I'm here, it's safe, everything's going to be okay. And then we have the next block, which is talk. So once we've engaged the social emotional right brain, for those who are right-handed, we then engage the left thinking brain, this part of the brain that deals with language, communication, logic. And this is where I add words. It's okay. I'm here. Are you hungry? Adding the narrative that's processing this experience for the baby. So I'm helping the baby to make sense of that experience, of that situation. So that whole sequence might only take a few seconds. And what it's done in the brain and nervous system of the baby is that it's built connections for regulation, for emotional processing, for social interaction, for recognizing social cues, and for attaching a narrative all at once. The first three blocks of 5 to Thrive, respond, engage, relax, provide the activities needed to connect and co-regulate. And the last two blocks provide the activities needed for integration or sense making of thoughts and feelings. And we also talk about what gets in the way of connecting to meet needs. So for your practitioners, that might be their own resilience levels on any given day. And things like bias, our own assumptions, or simply the perspective through which we see things. All of those things can be sticking points to doing the respond, engage, relax, play and talk. And 5 to Thrive isn't a program or a structured intervention, so it can really nicely sort of align to or be used alongside other models of practice to enhance the effectiveness of engagement with parents and children. And we're definitely not saying here that your practitioners aren't already engaged in this responsive, connecting behavior. They absolutely will be. They will be intuitively doing this every day, every moment of every day. As human beings, we're wired to be compassionate, connecting beings. Our brains are social organs. But what we're encouraging practitioners to do here is to understand that their brains and nervous systems are doing this every time they meet a need in another person. So 5 to Thrive is a model for noticing. And as I said, the more we notice it, the more we do it. And that's the same for the parents who are responding and nurturing their children. The more that they notice doing the responding and the connecting with their children and doing that brain building through play and talk, the more they do it. 5 to Thrive is also an approach. So it's when you are being the meter of needs, someone who meets needs, whether you're working with clients, service users, colleagues, children, families. It's about you being the person who meets needs. And it's also a framework. It's a framework for teaching or sharing the importance of responsiveness. And we can only respond when we are feeling resilient, when we're emotionally available, and sharing this with others, sharing the importance of self-regulation and sharing the importance of non-verbal and verbal communication. So connected relationships help to build resilience. So in terms of individual resilience, it enables us to recover swiftly from stress events. It means we can be emotionally available to others and we benefit from supportive relationships. And the same is true of community resilience. Our individual resilience doesn't exist in a vacuum. It's a function of our social and cultural context. So community resilience aids recovery. It provides a compassionate environment and helps us to build a network of supportive relationships. As Jack Saul says in his book, Collective Trauma, Collective Healing, your practitioners play a pivotal part in helping individuals, families, and communities access their strengths and capacities for healing and recovery. So this is just by way of a little taster, really, of the sort of thing that we'll be covering in the training. The hand model of the brain will be familiar to some of you and some of your practitioners. It's Dan Siegel's model, and we use it to illustrate what happens in our brains and nervous systems when we experience a stress event. So Dan Siegel says that when we experience toxic stress, so stress that we're unable to regulate through, or when we experience trauma, then we flip our lid, and the connections between our emotional brain and our thinking brain are lost. So there's a disconnect, and we can recover those connections and get our thinking brain and emotional brain working in an integrated way again through co-regulation. But if this co-regulation isn't available to us, then those crucial neural connections that we need for self-regulation, for processing information and experience, and for social responsiveness are lost. And then we're injured. So trauma simply means acquired brain injury as a result of unregulated stress. And I've just pulled all of this together on a slide for you that just illustrates a second model that we use in KCA called Mending Hurts. And this model simply pulls all of this together in a framework that's helpful for practitioners to grasp. And we'll be sharing some of this in greater depth with the champions who progress on to doing further training. So we have the impact of trauma on self-regulation and reduced ability to make sense of information and reduced ability to make sense of social interaction. So when we experience trauma, it affects our self-regulation, it affects our sense-making capabilities, and it affects our social responsiveness. The three phases of recovery from toxic stress or trauma are stabilization, integration, and adaptation. And in order to recover in each of those three phases, we need co-regulation, guidance, and support. And then at the bottom of this slide, you see the 9 outcomes of recovery from trauma. So when we've stabilized, we feel safe, we feel supported, we feel understood. When we've integrated, both have integrated brain function again, where our thinking brain and our emotional brain are working in an integrated way. And we've also made sense of our experience and what's going on for us, then we're better able to self-regulate. we're better able to say how we feel, and we're better able to say what we think. And in that adaptation phase, we develop social responsiveness. We feel joy in everyday living again, and we know that we matter. So we recover our self-worth. And self-worth is the last thing here, because it lives here. It lives in our prefrontal cortex, and that's the bit that gets bulldozed when we experience toxic stress or trauma. And of course, traumatized infants and toddlers need adults who can help them through these phases of recovery too. And 5 to Thrive very much underpins the Mending Hurts model and healthy brain development, maintenance of brain function, and recovery from trauma. And we must also be mindful of the fact that working with traumatized infants and toddlers induces stress in the adults who form that network around the child. The Royal Foundation Centre for Early Childhood's landmark public survey called State of the Nation, this is the Duchess of Cambridge's work, found that all those raising our under fives themselves need both practical and emotional supports. And the report describes professionals who make up the early years workforce and who stand alongside parents as essential caregivers who also need the right support and training. So those 9 outcomes of recovery that we just looked at are actually, you know, basic human needs. We all need those 9 outcomes. And our aim is very much about achieving reflective and sustainable practice through our learning content. You know, we want to take a whole systems approach, and we encourage and support application to practice. We work with commissioners and system leaders to consider mechanisms such as the champion model or developing communities of practice to support sustainability. And we want to ensure that our input is evaluated and that we have systems in place to ensure that Jenny and Liz are seeing this evaluation data so that we can see the impact of the learning content and also think about what else is needed. And through the learning that we deliver, we want to ensure that we're promoting social inquiry, experiential learning, and skills development. I won't spend too much time on this because you will be able to read the slide in greater detail later on. But I just wanted to share a really quick case study with you of a project in Hertfordshire that KCA are involved in called My Baby's Brain. Now, this was the project where 5 to Thrive was born. So it started with discussions with Hertfordshire based on the then coalition government's manifesto, highlighting the importance of the first 1,001 days and the importance of acting early to enhance the outcomes for children to counter the inequalities linked to unmet attachment needs. The importance of the developing neuroscience was highlighted, and it was Dr. Christopher Patterson who talked about the 5 a day needed for healthy brain building. And from that, you know, from a combination of Dr. Patterson's thoughts and discussions with Hertfordshire, 5 to Thrive was born. And this is an ongoing programme with Hertfordshire since 2011. And you can see some of the recent stats on the slides of outcomes experienced by practitioners who have attended some of our training events, with 97% saying that they felt that their learning had increased their knowledge of a baby's brain development, and 100% of participants reporting increased confidence in terms of sharing key messages with parents. And we have some really great engaging 5 to Thrive resources available to your practitioners, and all of these will be linked along with lots of other articles, blogs, recommended reading, scrolling videos, all sorts of other resources. These 5 to Thrive resources will all be linked to the various training events that your practitioners attend, and they will have access to all of them. So these are some lovely, really engaging, colourful posters to put up in settings or in training rooms or parenting program rooms for parents to look at and see. We have these great parental guides. They're available in English, Polish, and Welsh. And depending on the demographic you're working with, they're really great. They take parents through those 5 activities and what they mean and the sort of things that they can do to practice responsive, reflective parenting. We've also got some one-page profiles, which are really simple, effective tools for personalizing those 5 to Thrive activities. So by always starting with the box at the top that's entitled What People Like and Admire About Me and What's Important to Me, the process commences with positive reflections about the child. And this profile can be completed by parents, carers, those who know the child or young person well. And when possible, it can involve children themselves. So it's a person-centered tool which can be used in various ways, such as supporting new situations or experiences, new people and places, supporting transitions, supporting settling in activities for children, or just simply a way in which to provide consistent and responsive support to relax, interact, play, learn, and communicate with children. And there are 3 versions available now that will be linked to the resources, one for children, one for young people, and one for parents. And there's a slight change in the language used in terms of the prompts that are linked to these profiles so that it's age appropriate. We've also got this lovely parenting journal, which simply encourages parents to notice each of those 5 to Thrive activities. The extracted note on the slide is a lovely prompt that marks the 5 to Thrive activity that the parent notices. And the prompt simply says, you can write yourself a note or draw a picture or stick in a photograph or a scan or anything else that occurs to you that illustrates this 5 to Thrive activity. So a lovely way of developing responsive parenting. There's a set of lovely colourful set of drop cards that can be used in workshops, training sessions, or indirect work with parents and families. And again, depending on the demographic the practitioners are working with, there are pictures, 1-word drop cards, or drop cards with a bit more information and narrative. And those drop cards can be used really nicely with this activity here that practitioners often do with parents. They simply cut out this template, create their own 5 to Thrive blocks. And there's a 6th block that can be used as a dice. So you roll the dice, it lands on a particular activity, and that acts as a prompt for further discussion, and it can be linked with those drop cards that I just showed you. So lovely ways of engaging parents in these discussions. So the training that we deliver will include some of these key messages, that it's about noticing and valuing connection and compassion, which are key to building resilient, compassionate communities. And 5 to Thrive is simply a model, an approach, and a framework that can support in this work. Behavior is a communication of a need, so it's not attention-seeking behavior, it's not needy behavior, it's the communication of an attachment need, often driven by stress or trauma, no matter how old we are. And we all need compassionate connection with others when we're feeling dysregulated or destabilized, particularly children. We're all vulnerable and all resilient, and we need those relationships, those safe attachment relationships, to help build our own resilience. And every interaction is an opportunity to make a difference. And we'll also be asking practitioners to engage in some personal reflections around their own resilience too. They can't be those safe attachment figures, those figures that offer safety and co-regulation if their resilience is low, if they're feeling vulnerable. So this is about encouraging some reflection on where their own sources of co-regulation, guidance and support are in the workplace, in their personal lives. And it's a great activity, a great exercise for all of us, actually, you know, and a lovely one to do with your teams or direct reports. And finally, this, I just wanted to show you the learning journey that we're embarking on with Liz and Jenny. And although it says April to November there at the top, we're actually kicking off this learning journey on the 12th of May, but obviously we've had this system leaders briefing today. It'll kick off with a 90-minute webinar for multi-agency practitioners, just doing a bit of contextualization, thinking about attachment trauma and resilience and the importance of these connected relationships from birth and beyond. Linked to that webinar is some e-learning on community resilience and lifelong brain development, and it just gives practitioners a bit more depth on 5 to Thrive as a model, as an approach, as a framework, and it's there for them to sort of revisit, explore further, use for reflection. We say it's a notional 10 hours because there are knowledge checks and reflective exercises that people can pause and do along the way. But actually, you know, the e-learning can be completed in a much shorter time frame. And then we've got a 90-minute web tutorial for champions. So we'll be looking here at just encouraging that application of theory to practice. That's also supported with some further e-learning. And this will just help champions to think about, reflect on what secondary stress and what secondary trauma looks like in their services and settings, and how they can support their colleagues in terms of self-care and well-being. And then there's a day and a half further training for those champions who are interested in developing as in-house trainers. So those trainers will be drawn from that champion group, because we're hoping that incrementally they're building on their learning and knowledge. And so we'll equip them to go out there and deliver this learning and knowledge base to their own services and settings. And then we bring them back a couple of months after they've started delivery, just to check on how people are doing, where confidence is, what are the challenges, what are the sticking points, what are they learning from one another. And that's all from me. And I'm just going to leave you with this quote from the Duchess of Cambridge, which is that the early years are not simply about how we raise our children, they are about the society we will become. So thank you so much for listening to me. And Liz, I don't know if we've got time for any questions, but I'm really happy to take any if there is.
There is plenty of time. Simon, do you want to come in?
Yeah, I'm now to full disclosure, I'm here as an analyst. I'm not professional or clinical. I only have some anecdotal sort of, you know, background, I suppose. But this has really been an awe-inspiring presentation, like really meaningful. And I just think, I think toddlers, what people don't realise is, in a way, is that they appear fine when actually there's massive trauma happening within them, which will affect them in later years. And it's just this is a really beautiful package that's been put together. And yeah, I really applaud what you've done, and I really hope it's used, picked up, and spread as widely as possible, kind of thing. Yeah.
Thanks, Simon. And so really insightful of you actually to pick up on that sort of high levels of stress that babies and young children experience, because I guess everything's challenging, everything's new to them. And what's really interesting also about that is the work that we have to do to support adults to recover from trauma is exactly what we're doing with babies and young children. You know, we're helping to pattern the brain to recover those connections that have been lost through the trauma and get that sort of integrated brain function going again. So yeah, thank you for that.
I think what's so important, and as you raised, Simon, is that there's also all those hidden challenges that the pandemic has also given to us, with some delays to development, etc., where there haven't been all the baby groups and the social support that we might have had as parents and that as well. And so I think this is so important at this time. There's almost that hidden element that's going on as well as normal need as well. Catherine.
Hi, thank you. Hi, Liz. Hi, Anisha. My name's Catherine Hollins. I'm a parent, child and family psychiatrist based in the First 1,000 Days programme in Surrey. Anisha, spot on, fantastic. Such a great presentation. I mean, Simon knows it, not as a professional, and I know it as a professional. That it's just so great hearing your presentation, because you're just complete. I want everyone to know on the call who is less kind of connected that you're just spot on with where we need to be, and that's just so lovely to hear. And how exciting for the perinatal mental health services to gain this knowledge. So I'm really excited. It's really great. I've just been attending and engaging with some of the Compassion in Therapy Summit that has been online. The one comment I wanted to make related to that was the place of the body in trauma, and Bessel van der Kolk's work, which Anisha, you may well know about, and thinking about the cuddling being particularly appropriate with babies, but that actually how I hope that 5 to Thrive really keeps the body in the middle of how we think about addressing trauma and thinking about how we support parents to keep noticing. Your word noticing is lovely, how we keep noticing what's going on in your body. Where are you feeling this? But no, it's great. And I would love to I mean, it's funny, isn't it, how we can live in these parallel worlds. I ran the perinatal and parent infant mental health service at Chelsea and Westminster for 10 years, up until about 7 years ago. And now I'm in the First 1,000 Days, and I would love for us to connect up with the First 1,000 Days programme in Surrey Heartlands. And I'm very jealous that Frimley are doing this for over 2s already. So we'll have to talk more. Thank you.
It's great, Catherine.
And I think that's very much our approach. So although this kind of particular element of training is obviously based around the perinatal mental health pathway, but it's how do we start to kind of change that way of thinking and talking, as we, take things forward into children and young people, and that how do we holistically as systems start to think differently and have that commonality of language, and that is really important. So yes, very keen to link up with 1,001 Days, and I think the kind of early discussions as well as in terms of the long-term plan. The next iteration is that obviously that real focus on infants, and so that's great to hear. It's fabulous. Thank you. Any other thoughts, comments, questions? So whilst people are thinking if they have got anything else to say, I guess our thinking today was really, as we said, was to give an introduction to the approach, to the model, what we're doing in terms of the training that's going to be rolled out. Obviously, services within the systems are aware of the training, but please do, obviously, when you're talking to your services, and that remind them that this is happening as well, so that we kind of infiltrate from all angles, and happy to come back and share further information. As Anisha said, there will be an evaluation as part of the training rollout, and it's quite ambitious to do this at such great scale across the whole region. So we're aware that it's ambitious and it's going to be challenging, but previously in terms of rollouts across the pathway have been successful. So we look forward to seeing it continue. Any other thoughts or comments?
Liz, I just noticed Samina on the line from Frimley. So lovely to see you, Samina.
Yes, thank you. Sorry, I joined late. My other meeting ran over. So yeah, no, it's great to be here. Thank you. And 5 to Thrive and the work we're doing in Frimley is just phenomenal. And as we're gearing up, it's just such an excellent tool to add for staff and you know, practitioners, professionals to have that insight and knowledge and see how they can take that forward. So yeah, you know, I think it's really great.
Thanks,
And
Amina.
it complements the national programme, like you say, the under 2s, and now we're doing the 2+, which gives people the option of how they can access the programmes.
Can I perhaps say something else as whilst other people are thinking? It was just about the 0 to 5 children's services, and you were mentioning about a survey, you know, in relation to that. But I mean, obviously, in most places around the country, there's a real gap, isn't there? And are there any thoughts about how you're thinking, Liz, you're thinking, Anisha, about this issue and how we work together to do something about this gap? Because there's no seamless transition right now, you know.
So obviously the regions have changed in the last couple of years, but when so prior to the pandemic, so in sort of 2019, when we at that point were or I was in Wessex and Thames Valley, we did a piece of work looking at the gaps. So basically looking at what was in situ within that regional geographical patch. And as you well say, Catherine, there was more gaps than services. And I think currently, as we're just kind of looking at our priorities for the next couple of years, Gavin Lockhart and I are looking at that, you know, so where do we sit with that kind of infant mental health, and also the old challenge of who's responsible for that, you know, in terms of perinatal or CAMS often, and also the challenge with the demand and capacity for services as they already exist, and how do we therefore expand in order to address that. So it's definitely on our agenda. I'm not sure that we've got a complete plan yet, but certainly looking at it, so we can certainly come back to you. But I think what we're trying to do with these kind of things is start to look at, so how can we start to spread and try and start to you know, kind of fill in some of the gaps, appreciating that we obviously need to put services in place, and there are obviously challenges with funding that goes with that.
I guess it's always what comes first, isn't it? You know, where and we've developed a best start for Surrey board, which is very much is conception through to age 5, bringing together various services in Surrey Heartlands and Surrey. So that will help us, I think, to make this more and more obvious that, of course, there's a gap then in terms of specialist services for that age group, so that you know, you can think about pregnancy, you can think about the first year, then the second year, well, what next, you know, what next? So and
some of the training that we've done to date, so in the last financial year with the specialist perinatal mental health services as well, is thinking about, as they're extending their kind of cohort in terms of that 12 to 24, there's different needs for that, you know, in terms of the babies, and then as they're turning into toddlers and infants. So, you know, what did we need to do also to upskill staff in that area? You know, the nursery nurses are well trained, but how do we also you know, kind of extend the training across the workforce? Catherine, I can see you've got your hand up.
Is there another Catherine? It wasn't me, was it?
Sorry, yes, sorry.
Sorry. It's another one, Catherine with an E-R-I-N-E.
We could get into a Catherine discussion, couldn't we?
We could, absolutely, absolutely. I guess it's a slight diversion from the topic, but I guess it's something that's just interesting me. The other Catherine, you mentioned the importance of involving the body as far as you know, working on this sort of plan to achieve as much as you possibly can. I've noticed with family friends who have small children, the impact of COVID that has had on their ability to share their bodies, if I mean that in the widest sense, and in not any sort of nasty sense, but just seeing very young children being reluctant to touch surfaces, to touch, you know, to hug each other, to hug, you know, close family members, even because they have had it ingrained in them over the last year or so that actually, you know, there is this virus which they don't obviously understand, and if they touch something, then other family members may become ill. And I just wondered, Anisha, whether there has had to be some sort of integration of that impact that's had on young children, particularly who maybe don't have the levels of understanding about COVID, as to how that would fit in, because I know other approaches have had to think about, you know, the pandemic from that point of view. It was just a thought.
Yeah, no, absolutely, Catherine. It is so interesting, isn't it? I mean, I guess, you know, part of the message that we're wanting to give and trying to give is that, you know, the brain is very adaptable, and there is still time, you know, to you know, where we're all going around with quite anxious brains and nervous systems, you know, for those little children to have those experiences of, you know, exploring again and playing again, and, you know, touching surfaces without being anxious. So those, you know, there's time and opportunity still as things open up, as normality, you know, or whatever this normality is, returns. For those children to you know, for their brains to be patterned still, to develop those healthy responses, the healthier responses, I guess.
But I guess, as you sort of thinking about, if you think about the adult world, I guess we are aware of what it was like beforehand. But if you think children who have been born during pandemic, who may have had mothers who went through birth on their own, you know, as we know, right at the beginning, that was a situation that it must be so strange. I know they're all talking about a new normal now, but I just kind of, it's almost like these children have been born into this environment. It'll just be fascinating to see, and I guess it won't be for many years that we'll see the effect truly on young children. It's just an observation more than anything.
Yeah, and I think we, you know, part of what we're sort of encouraging is the, you know, those identifying of those support networks, the you know, the people around the child who can support that development, but also supporting parents who've also not had some of those socialization experiences over the last couple of years, particularly if they are young parents or parents with very little ones. No, but thank you for that.
Sorry, can I just add as well? We've seen in Frimley Trust an increase in mothers with babies under 28 days presenting at A&E. There's been a significant increase, and but there's also a significant increase in no abnormalities detected. So, you know, the anxiety of the mother and then bringing the child that's 28 days, under 28 days, presenting themselves at A&E to be told, you're fine, there's nothing to worry about, which again for me goes back to that connection with health visitors and that practitioner support to give that reassurance and those thinking skills. So we are seeing, you know, we are seeing those increases, and there's been some work done around maternity sort of mental health and well-being, but I still think, yeah, the data, some of this data stuff, sometimes it can just segment. Oh wow, gosh, I wouldn't have seen that. So yeah, but it's because health visitor contracts or brief has changed considerably, and it's very transactional. So the other handholding and other emotional support, that they have such a long shopping list that they have to get through, that nothing, you know, the other conversations don't take place. I mean, my children are in their 30s, but the stuff I used to talk to my health visitor, I think if I was having a baby today, they'd be like, excuse me, can we keep to the brief? So yeah.
And I know one of your questions was about how will we engage with health visitors. So through much of the training, other elements of training that we've rolled out to date, we very much involve health visitors as part of that pathway. So we will go out, as we always do, to the various health visitor services, looking for champions, etc. Across that. So yeah, they are always already included in the perinatal pathway training.
It's excellent because we're about in Bracknell, they're just about to recommission the service. So for me, it's whatever else we can add as the breadth of engagement and integration, then well, we endeavour to do that. So yeah, no, brilliant.
Fabulous. We've got a question about how can A&E staff be supported, to say, I hear you, I hear, yes, you're anxious, let's think about how, who and where and what can support you closer to home. And I think that's why with so much of the training that we've done to date, I think within the region, when the money first came to support the expansion of the specialist perinatal mental health services, it was very much focused on specialist perinatal mental health professionals. And Jenny and I very much took the approach that we needed to train the full pathway, because actually we need to educate people so they can pick up on those telltale signs rather than waiting till we've got potentially a crisis point and they need specialist services. And so we challenged quite strongly with the national team and both in perinatal mental health and HEE to say, actually, we're going to take a different approach and we're going to put our necks on the line, and absolutely we will do specialist training, but we also need to do the full pathway. We did a big project, which we're still continuing with, the training happens every year for maternity support workers, etc., because often they're the people that are having the interaction with new mums, but knowing that they don't need to have all the answers, but how to kind of delve into the questions. So it's actually called the I'm fine training, because that's often the response, I'm fine, but actually how do you delve behind that? So really, really important. How do we train our wider workforce, so that they know who to signpost onto and what are the red flags, really, aren't they? Yeah. Lovely. Okay. Well, if we haven't got any more comments or questions, you will get 20 minutes back of your day, which is always important by midweek when we're all probably running behind. A massive thank you to Anisha and all the team at 5 to Thrive. It's a fantastic package that they've put together for us in the South East, and we're really looking forward to the rollout. As I say, the first webinar that Anisha's mentioned is happening on the 12th of May. So that's Thursday, the 12th of May, 10 to 11:30. And then the further training will follow. So please do get in touch to hear more about it. And hopefully we can come back to one of the future system leads meetings to talk a bit more about the evaluation after the training has taken place. One thing I did want to just check before we sign off is, knowing that there will be people from across the systems that have joined today, is there anything or any other business that people wanted to raise, anything that you want me to take back or flag to the regional mental health team? It's your opportunity to say if there is anything.
Liz, just while people are thinking about that, could I just make one more request, which is that as system leaders, you go away, you talk to your teams about this fantastic learning offer, and please encourage people to sign up, but also having those discussions with your line managers and your team leads about who might be a great 5 to Thrive champion or in-house trainer. What we've learned from other projects is that it all, success or not, actually really depends on what the system leaders are saying out there about the offer. So please do encourage your teams to sign up. Thanks, Liz.
No problem. So we will share the recording will be on the website, and we'll share the slides from today so that you can also distribute or pass the link on to others that weren't able to attend. Catherine.
If this isn't a silly question, who actually can attend the training? So who are the people who can attend?
So to be fair, for the webinar for the 12th, it's really open. We basically have got unlimited numbers. So obviously we're targeting, kind of core groups and services, but please feel free to pass on. We're not going to hit our, you know, a threshold where we won't,
Yes.
you know, we'll be at capacity. So it really is that kind of introductory webinar. The more the merrier, to be fair. And what we're also encouraging people to do is, even if you're not able to attend physically on the day, if you sign up to the webinar, then you'll get sent the information and the recording, etc. So we're really encouraging people to do that. So even if you can't attend in person, that at least you're signed up then to further information as we do the further cascade of training.
And then the training that's carrying on up until November, that's the specific perinatal mental health teams, is that right?
So it's wider than the perinatal mental health teams. It is around the pathway. So we're also we're hoping to get champions that will be health visitors, that will be within maternity, you know, that will be wider within crisis services, etc. So there is that opportunity. We've got quite a large number of champions that we're planning to you know, to train. So, and what we're looking to get is obviously that geographical spread across the whole of the southeast, but also thinking about the different parts of the system and services that come into contact with the perinatal mental health pathway.
So in terms of how, in my role with First 1000 Days and linking in it with different parts of the system across Surrey,
Yeah.
who would you want me to? Have you still got places for that ongoing training? And
yes, so that we
Yeah.
haven't honed down yet. So what
Yeah.
we've sort of said is the webinar will take place on the 12th. We'll kind of at that point be looking at expressions of interest in terms of
Okay.
going forward for champions and that.
Okay.
And then our plan is very much to work at looking at about how do we try and get that spread across. So
Brilliant.
yes, please do. We're, you know, we're really open to that. We're not going into this with a kind of this is who we expect it to be. We want to look at kind of really opening it up as wide as possible to get that holistic kind of regional approach.
Okay, thank you.
Fabulous. Okay, thank you everybody for your time today. Really appreciate it. I know you all have really busy schedules. We are really passionate about this. It's a really important issue in terms of, you know, if we get it right for our 0 to 2, 0 to 5, we get it right going forward. So really important. So thank you all, and wish you a good rest of the day.
Thank you.
Thank you.
Bye-bye.
Bye.
Thank you.
Bye, everyone.
Bye.